Hello everyone, welcome to the third episode of Let's Talk Health by Star Hospital. I'm Dr. Ankita Harijee. I'm a consultant at Star Hospital in Plastic Surgery Department. Today I'll be hosting this show. We have Dr. Rajesh Vasu, who is the Senior Plastic Surgeon at Star Hospital. Today both of us will be addressing the myths and mysteries related to aesthetic breast surgery. So sir, please tell us that when patients come with complaints of heavy breast, so how do we consult them, how do we deal with them, and what are their major problems besides being the aesthetic reason complaints?
The maximum number of patients who actually visit plastic surgeons for breast reduction surgery do have some amount of symptoms. They have symptoms like their bra straps cutting through their shoulders. Some of them experience fungal infections underneath the breast. Low backache or even cervical neck pain could be issues with these patients having heavy breasts. So often they are referred to us from orthopedic surgeons. So it's from orthopedic surgeons that they come to us because they would have gone for their neck treatment and then they would have found out that the breast is the problem. So this is how our patients having massive breasts present to us plastic surgeons. So when we are dealing with patients who have these symptoms, this is the group of symptoms which have maximum benefit. Of course, there is a lot of cosmetic benefit which you may have after a breast reduction surgery, but if you have these symptoms, it's going to be wonderful for you because none of these symptoms which you have will actually be reduced after a breast reduction surgery.
So sir, many of them are apprehensive that how their scar will turn out to be after the procedure and how it will settle, how it will look. So can you tell us something about it?
Yeah. Breast being very sensitive and very private areas, a lot of our patients are actually apprehensive about the scarring issues. Now, if you go back a decade ago, there were techniques which involved a lot of scarring, and obviously patients looking at the net, they get carried away with these kind of pictures, and they're not really happy with the scarring issues, and that's why they ask whether they're going to have any scars. But in the modern day breast reduction surgery, we do techniques which have very minimal scarring, as opposed to the techniques which were done 2 decades back. So right now, what we do for all our patients is the modified Hall Finlay's technique, where the scarring, instead of it being like a anchor, it's like a small gentle J. So that's very minimal, and most of the patients after finishing their surgeries, when they are actually looking at themselves in the mirror, the scar is actually visible only just 2 centimeters below the areola, which is very acceptable.
So we do have even the concerns related to breastfeeding and what happens to the sensation of the nipple area if they get surgery done. So can you tell us, like, does the surgery really affect the lactation and even the sensation?
Yeah. So the beauty of breast reduction surgery is not just to remove all the excessive tissue, but being a very sensitive organ, one must preserve the lactiferous ducts or the milk producing ducts which our patients may actually want to conceive again and maybe want to breastfeed again. So they are very concerned about this particular aspect. Now, because of the modern breast reduction techniques, we preserve a significant amount of lactiferous ducts so that in the future they can breastfeed. And I have had so many patients who call me 3 years down or 5 years down the surgery, they had breast reduction surgery, they call me and saying that they have successfully breastfed these patients. So breastfeeding is really not a problem once the breast reduction surgery is there. And the second question which you asked is the sensation. Sensation is such an important issue. Now, when we are doing the breast reduction surgery, there is a way of doing the surgery. So we preserve all the nerves which come from the sides of the breast. So there is a technique where we preserve all the the deep muscle fascia, and once this muscle fascia is preserved, usually most of the patients will have a normal touch sensations, which is so important for our patients.
So, sir, as we just discussed about breast reduction, there is another element, breast augmentation, and most commonly we use implant for that, the silicone-based implant. So, can you tell us like how long does it last, and is there any like they have to change it frequently, and how comfortable and natural feel does it give, or like there are any chances of cancers related to it, because this has been creating a lot of fear among the people to go ahead with this procedure.
Yeah. Yes, Dr. Ankita. I think when it comes to breast augmentation, this is the most talked about topic on the net. So obviously, our patients have so much of information, so much of misinformation that they can have so many questions that they want to ask their surgeon. So now we are in an era where we do the state of the art in breast augmentation. The present generation of implants compared to the older generation of implants, which were actually oil filled, silicone oil filled, where the silicone, there was a very high chance of rupture of the implant, and there used to be these oil leaks leading to a lot of dreaded and ghastly results. So this was like way back in the 60s when the implants were actually invented. But now we are in the 2023. We have the 7th and the 8th generation implants. The shell is so thick that it withstands a lot of pressure. The chances of rupture are very minimal, and even if there is a rupture of the shell, the gel which is actually filling the implant, it's so cohesive, it's so compact that it doesn't leak out. So there is no problem with actually the implants as such. They are very, very stable, they last long. Some of my patients, we've actually operated them maybe around 25 years ago. They still don't come back with any desires wanting to change their implants, which means they're doing pretty well. But our companies give out information that any patient who is beyond 15, if they have a noticeable change in size or the shape is altered because of issues, they can always get it done. But I think the modern generation implants are safe, and you can use it for a good amount of time. Now, coming to your second question of cancer, this is another topic which patients have many questions about, and they think that by putting something foreign, there is something which can form, cancer can form. Yes, these are all very rightful questions. Now, if you actually look at our literature, the so-called anaplastic large cell lymphoma, which has been reported over the last 5 or 10 years, this has come into more and more reporting. But however, one need not worry about the issue of cancer, because the incidence of this cancer is as low as 1 in 40-50,000 to 1 in 80,000, which means every patient having this issue happens only 1 in maybe 70 or 80,000 patients, which is very minuscule. And even if it is seen, let's say in that rarest of the rarest occasion, the treatment for this would be to remove the breast implant and remove the capsule which actually forms around the implant, and that's the end of the treatment. So one need not worry about the anaplastic large cell lymphoma after having breast augmentation done with silicone implants.
So, is there any other option besides implant for augmenting the breast? Like people who don't want an implant, like some people have inhibitions with artificial material in their body.
Yeah, there are a subset of patients who are actually very worried about something foreign being put into them. They don't like this idea, and they feel that natural is the better ones. And so these are the group of patients where we can give them the option of fat augmentation. So the commonest area we take is the abdomen or the thighs, and this can safely be processed and it can be re-injected into the breast. However, the information which should go out to our patients is that silicone implants can look really to a bigger size, because you can actually add up the volume based on the patient's dimensions and based on the patient's desires. So it can go really a large size up. But when you're using fat to augment the breast, the size can only be increased by 1 cup. So that's something which our patients need to understand. And if they want bigger and bigger cups with only their fat, it has to be multiple surgeries as opposed to only one surgery with silicone breast implant. But of course, a lot of our patients prefer their own body tissues like fats, and these can be used, and we are using it for these group of patients who accept that minimal augmentation is okay for them.
You just mentioned that like with the implant, they are expecting a particular cup size, and with fat we get a increase by 1 cup size.
Yeah.
So can you tell us about how do they decide, like how can they achieve this much of cup size or dimension, what size of the implant,
Yeah.
or what volume of the implant should be
So
put?
this is what you've actually mentioned is what we plastic surgeons precisely do for our patients with breast augmentation. Like I get patients who actually get pictures of what they want, looking at some Bollywood or Hollywood actresses, and they want those kind of things. But the reality is every patient has a unique anatomy. Every patient has a dimension to their chest. So as plastic surgeons, what we do is we talk to our patients, we examine them. The examination is really important. That's because the dimensions decide what implant actually goes into the patient for a better fitment. So during the examination, there are so many parameters which we use, like measuring up the diameter of the base of the chest. At the same time, we also take thickness of the skin, which is actually going to cover the implant. So based on these diameters, we would go back to our the implant catalog tables, and we would say that for this particular base width, this particular dimension is, this particular volume is actually most suited. And then we are now in a place where we have the softwares which actually help our patients choose their sizes. We also have the bra sizing system which we so commonly use. So let's say after doing the base width diameter calculations, and we see the catalogs, and we tell the patients that this is the size of implant which is going in, and based on our external sizing kit, we take the same size of implant, we mimic the implant's volume by putting the implant under the bra, making the patient wear the bra and the external clothing, and see in front of the mirror to see whether she is actually happy with the implant. So now here we have a patient who does all this. She looks at the mirror and she looks at herself and says, probably I might have to go a little down, which is okay. We choose an implant which is a little smaller, or sometimes they may even feel otherwise. They want maybe a size a little bigger. Let's say we've showed her a 300, we can go to 340 cc's implant and show her, and she's happy. If she's happy with 340, we know that this is what she is happy with, and that's what will give her the best results.
So sir, we do have a couple of patients, like set of people who have undergone pregnancy, and after pregnancy they have sagging of their breast, even the reduction in their volume. So what are the options available for them? Can you tell us about that?
Patients coming to us for breast lift is a common problem, especially after pregnancy. Women have multiple issues, not just sagging, but they have a change or alteration in their shape of the breast, which might not be matching their requirements, and they also feel that the breasts are lacking in volume. So when they come to us with this problem of sagging of the breast. As a plastic surgeon, it's our duty to educate our patients and tell them that it's just not a correction of the sag, but we also help in increasing the volume of the breast and also help in shaping up the breast, which is so very important for our patients, especially in after pregnancy, when they lose all the weight and they get back to their normal state, and their hormones are also again back to their normal. there is a lot of sag, and this is addressed very well with mastopexies or a breast lift, along with volumizing the breast, or even increasing their volume by fat injections. So there's so many techniques which are available for our patients with sagging of breasts. And once the augmentation mastopexy is done, the patients often get back their self-esteem, their confidence, and they can get back to their normal livelihoods.
So we do have a couple of patients who had breast cancer and they undergo surgery for that and they don't have any breast. So what are the options available? Like how can we help them out and create an awareness that there is an option available, that even after the surgery for breast cancer, they can still get the breast volume back, breast shape back.
Yeah.
So can you tell us about that?
So our cancer patients are those patients who already have had one big blow, and they have a very, very poor self-esteem because of the unfortunate incident of a cancer being removed. So these group of patients, they really need to be aware of their options. So as plastic surgeons, we give them options which can be as early as when the cancer is being removed, that is immediate reconstruction, and as well as a delayed reconstruction. Some of our patients who undergo the cancer treatments are in a very early stage, and where the risk of recurrence is very, very minimal. So in such patients, the oncologists themselves will prefer an early reconstruction. So when we talk about any reconstruction, whether it's early or late, you have local tissues which can be borrowed from the vicinity, and you can also take flaps or tissue from the distant areas in the form of microvascular surgery. So let's talk about what is locally available. So these are called local flaps, and these flaps, without distorting the body or other areas, can be moved to the areas of the breast, and the breast can be nicely reconstructed. We also have not only natural methods of reconstruction, but we also have tissue implants, tissue expanders, which can actually come to our rescue when it comes to building up the breast. So after mastectomy, you must realize that the entire volume of the breast is removed, and sometimes the surgeon as well as the patient may actually opt for a delayed reconstruction. They would want to wait for at least 9 months to a year, and to see that there's no cancer which is actually coming back. And once the surgeon and the patient are very, very clear that there is nothing coming back, yes, the patient would want to get the breast reconstructed. So one of the options that we give to our patients is non-tissue based reconstruction, which is in the form of breast implants or tissue expanders. So tissue expanders, we use it when there is actually complete loss of tissue. The skin is so tight that it can accommodate nothing under the skin. So this kind of situation will demand that we use expanders. So expanders are put under the skin, and we expand the skin, and once adequate expansion is done, and then we can either put in a silicone implant if the patient chooses, or we can even use the patient's own tissues, like autologous tissues like the fat, or distant tissues like the lower abdominal tissues. So we give them a lot of options, and it's for them to choose. Ultimately, it's our responsibility that we need to keep the patient completely informed, and these are patients, they have already suffered, so we need to really empathize with their problems and give them solutions.
So there is one more segment which is related to male breast, and most of them do get it done commonly now since the awareness is so much available.
Yeah.
But many people have unhappiness also related to the results.
Yeah.
So how differently we do this surgery, and how are our results? Can we just give some information regarding that?
Male breast surgery is such a common surgery. I think if you go back to the data, it's probably the second most commonly performed surgery in males. So that's the kind of population, that's the kind of numbers which plastic surgeons do. And yeah, just like it's as common to do a gynecomastia surgery, so are the undesirable effects or the complications. So, being a center where we do high volume cases of aesthetic breast surgeries, yes, we get a lot of patients, unhappy patients who had a prior gynecomastia surgery. And what is it that we are doing differently is in terms of our assessment of gynecomastia. So when we're talking actually about gynecomastia surgery, we must actually respect the patient's own body. And if you look at so much of work done by very senior plastic surgeons like Hoyos, they just don't remove the breast because it is prominent and giving that saucer effect. That is not what our patients want. Our patients want a nice chiseled, sculpted breast. They want the gland to be down. At the same time, they want their pecs to show up. So one of the common error which surgeons may do is to remove too much of fat on the chest. So once there's so much of fat being removed, it causes a lot of depression, and this depression, it's not easy to correct. You need to do again repeated fat injections. So why would you want to actually do so much of liposuction on the top of the muscle? So this is something which we are very careful in doing a liposuction. We would do very minimal liposuction here, but where there is a lot of gland which is under the pec muscle, that's the place where we do a lot of suctioning, thereby getting the pectoralis major to stand out. The chest muscle actually stands out when we actually do more liposuction over here. So that is where we do maximum amount of liposuction. Now, the other commonest error which can be made is to either remove too much of gland or to remove too little gland. Now, if you remove too much of gland, again you can have a saucer kind of an effect or a depression which is so difficult to correct. So, how we do it is, when we are removing the gland, we preserve some amount of fat which is abutting the muscle. So that kind of gives support, and the areola sits on the chest wall without causing any depressions. So that's how we do it differently. Now, there can also be a situation where you can remove too much of fat from under the areola. Now, when you remove too much of fat from the areola because of the want of wanting to keep the patient happy, you can actually compromise the blood supply of the nipple areola, and you can have a lot of healing problems. You can have, the nipple being eaten away by want of blood supply and infections, and subsequently wanting to do a reconstruction. This is something which, as plastic surgeons, we should avoid at the initial surgery itself. So our technique of doing the gynecomastia would be to preserve 2 to 3 millimeters of a cuff of tissue under the areola, so that the areola's blood supply is maintained. At the same time, you're not giving this problem of recurrence. So that is something which we do routinely in our patients. So aesthetics, keeping aesthetics in mind is paramount when we have to give good results. Now, the final problem which can actually happen in gynecomastia is the scarring. Even though the techniques have evolved, and we are giving we have progressed from the scar which is in the lower part of the areola. Now we have moved on to a technique where we just give 1 centimeter of incision, and through that 1 centimeter of incision we knock off all the gland. That's something which is very minimally, and we can barely see the scar. So as opposed to surgeries which are done in other centers or by other surgeons, where they might give a bigger scar. So we have even done away with that extensive scarring, and we remove all the breast tissue with this. So when we keep the incision small, the scarring is less, and the sensation also is much better. It recovers faster, and of course, keeping all the aesthetics in mind, most of the patients are really delighted with their results.
So we have discussed almost every myths and mysteries related to breast related surgeries. The key lies that we should, consult with the patient, know their requirement, empathize with them, and with our state of art of technology and the surgical techniques available, we can address almost all the concerns they have. And this not only helps in getting rid of their functional issues, this gives a boost to their confidence, and they can actually live a better life which they were hesitant because of the issues they were facing. So with this, we conclude our show on myths and mysteries related to breast surgery. I would like to thank Dr. Vasu to give us such useful information related to breast surgery.